Hey guys, Jan Kang here. So I'm gonna be talking now about chapter 11. That's on addiction and drugs. Now, actually, even if the Brain Bee hadn't covered this topic, I would have really wanted to talk to you guys about this because this is a perfect example of why neuroscience is so important. Because neuroscience affects culture, it affects society, it affects the way we live, and when you talk about drugs with neuroscience, that's like a perfect example. I mean, I'm going to college soon, right? And you guys are probably going to go to college in like a few years, right? Actually, in 1 year for 2 years for some of you. And when you go to college, you're going to be exposed to this kind of controversy, right? You're going to be exposed to, people who have had their lives ruined by drugs, and you may even be approached by someone, and you may be asked, "Hey, you want to try this drug?" Right? And in that moment, as you refuse, I think it's really important that you guys are well educated on exactly why drugs are so bad and what how drugs affect society and our brain. And so this is a really, really important topic, and I'm really glad that I'm getting a chance to give you guys this talk. So without further ado, let's just get right into it. So drug abuse, a really, really serious problem in America, right? Drugs are addictive, and that's the main reason why it's so bad. But how? Why? Right? Why is it so addictive? You can explain that with neuroscience, right? You have a specific network of neurons in your brain called the brain reward system. Actually, and the circuit is normally involved in an important type of learning that would actually help you stay alive. You have to know what's good for you, right? Evolutionarily speaking, you have to know what's good for you. The way you know what's good for you is it gives you pleasure, right? And that's the purpose of our brain reward system. But drugs take advantage of that system, and they mold your brain so that you can only be stimulated through the reward system by those drugs, and that's the reason why drugs are so addictive. So there are three main parts of the brain reward system: the prefrontal cortex, the ventral tegmental area, and the nucleus accumbens. So these three main parts of the reward system are stimulated by every drug that I'm about to cover. So drugs are really dangerous because they mold your brain so that the reward system can't be stimulated by any other means except by those drugs. That's where you get the tolerance and the dependence on those drugs. So, however, the actual what happens on a cellular level, on a molecular level, it's going to differ for every drug, right? So that's now we have to look at each individual drug and see what exactly happens. So let's open the talk with nicotine. So nicotine is the addictive substance inside of tobacco. Obviously, you guys know smoking is a big problem. It causes lung cancer. Causes an increased risk of gum disease. So nicotine is the addictive substance inside of tobacco. And the reason why it's so addictive, it acts as both a stimulant and a relaxant. Nicotine will stimulate your adrenal glands, and you're going to get kind of a discharge of adrenaline. You're going to get a kick. But at the same time, nicotine is going to release dopamine, the brain regions that control motivation. And that's one reason that people continue to smoke. And the reason why it relaxes you, people describe that they feel relaxed right when they smoke, is because the nicotine, it works at a nicotinic receptor that deals with acetylcholine, and this receptor actually has the effect of causing your parasympathetic nervous system to relax your body. So this is really, really bad for your body when you look at it, because nicotine, it's the addictive substance in tobacco, and when you're addicted to the nicotine, you have to keep smoking it, and it's going to damage the rest of your body. But anyway, nicotine, that's what it does on a cellular and molecular level in your brain. Number one, it goes to the nicotinic receptor and causes acetylcholine to act on the parasympathetic nervous system and relax your body. At the same time, it stimulates the adrenal glands, causing a kick, and also stimulates the release of dopamine in the reward system. So how do we treat a nicotine addiction? Well, there are two main drugs that the book discussed: bupropion and varenicline. Bupropion is an antidepressant, and it has been approved as a pharmacological treatment for nicotine addiction. The other thing is varenicline, and varenicline is for smoking cessation, and it actually blocks the acetylcholine nicotinic receptor. So those are the two drugs that they use. They've also seen that behavioral treatments are important as well when you have to teach somebody to cope with preventing a relapse. So that's nicotine. So the next drug we should talk about is alcohol. It's alcohol. So when people think of drugs, typically they don't really think of alcohol, but yes, alcohol is a drug, and definitely it's addictive. So how does it work? When you take in ethanol, which is the active ingredient in alcoholic beverages, it's going to interact with the GABA receptors. If you guys remember from way back, GABA receptors, they work as inhibitory areas, right? When alcohol interacts with the GABA receptors, it can calm your anxiety and impair your muscle control, delay your reaction time. But at higher doses, it also decreases the function of NMDA receptors, and that recognizes the neurotransmitter glutamate, and that actually clouds thinking and eventually leads to a coma. So essentially, at lower levels, you have alcohol. You have alcohol working to impair your physical side, but then when you at higher doses, you get alcohol working at the receptors that deal with memory and thinking, and so alcohol is really, really bad for you. So how do we treat alcohol addiction? So they have that one main drug that the book talked about, naltrexone. It works by blocking the opioid receptors. However, it can be used to treat alcoholism. This is because alcohol has been shown to activate the endogenous opioid system as well. So naltrexone is going to block alcohol from working at those endogenous opioid receptors. And we really do have to deal with the alcohol issue. It's the leading preventable cause of mental retardation, cirrhosis, scarring of the liver. That's another really bad problem associated with alcohol addiction. So definitely tackling this is a big public health issue. Now, the next drug I want to talk about is marijuana. The active ingredient in marijuana is THC, or tetrahydrocannabinol, and actually it binds to specific receptors called cannabinoid receptors. And when it does, it actually impairs your movement, and this is because your cannabinoid receptors are important in coordination of movement. And actually, this actually explains why people have impaired movement abilities after they smoke marijuana. And the interesting thing is the hippocampus, which is an area important for memory, it also has a lot of receptors for THC, and this is the reason why people who smoke marijuana have poor short-term memory and problems processing complex information. Now it's interesting again. A lot of times, the theme of this chapter, drugs, basically it's a perverted version of what's going on in your brain chemically. Which means that there has to be, the cannabinoid receptors have to have a way to act normally, right? Because drugs are perverted are a perverted version of the chemistry in your brain. So scientists actually discovered that cannabinoid receptors actually bind to natural internal chemicals called endocannabinoids, and a good example would be anandamide. And actually, these endocannabinoids actually have effects in your brain and nervous system, right? And these are actually helpful for your body, but marijuana will actually bind to those receptors, and it'll essentially be a perverted version of what should be going on. So that's just a theme that you guys have to know about drug abuse. It's a perverted version of the chemistry in your brain. So the next the next drug I want to talk about are opiates. So opiates, when you think of opiates, the first thing you should think of is heroin. And heroin is actually really, really fast acting. It's about 15 to 20 seconds. It's going to bind to your opiate receptors, and it's going to cause a huge euphoria, and then it's going to cause a couple hours of a relaxed, contented state. And opioids are actually like your body's natural painkillers, right? But in large doses, heroin can actually make your breathing shallow, stop it altogether, and that's usually why people who overdose on heroin die. Again, drug abuse, when you look at it, the theme is that it's a perverted version of the chemistry that's normally going on inside of your brain and your nervous system. You do have natural opioid receptors that do naturally take natural endogenous opioids, such as enkephalin, and these usually act as like painkillers, right, for your body. But heroin, when you take heroin, that's you're misusing that natural system that you have in your body. So how do we treat heroin addiction? Well, we have actually a lot of different cures. We have methadone, naloxone, naltrexone, buprenorphine. The book describes all of these. They describe naloxone and naltrexone act as antagonists at the opioid receptors. It describes buprenorphine causes a weaker effect on the receptors and only creates like a limited high. Methadone isn't it just curbs a lot of the aftermath effects in general. Curbs the craving, the withdrawal, the relapse. So now the next drug we have to talk about are psychostimulants. So cocaine, amphetamines. So the way cocaine works chemically, the book gave a really good picture to describe it. You have your dopamine at the synapses, right? Usually dopamine, it's reuptaken, right? And it's recycled. But when you take in cocaine, it's gonna block that reuptake, and so your dopamine's not being recycled. It's just staying there at the synapse. That's why you get the high. And eventually, however, the cocaine users, however, after a while, they're going to go on binges and they're going to consume a large amount of the drug in just a few days, but eventually it's going to lead to a crash. And you're going to get emotional and physical exhaustion. You're going to get depression. And actually, this actually happens because of an actual shutdown or crash in dopamine function. And right now, to try to figure out what we can do about this issue, scientists are developing vaccines to produce antibodies to cocaine in the bloodstream, and we're in clinical trials right now. So the last drugs I want to talk about, the book just generally categorized them as club drugs. So these would be like ecstasy, rohypnol, GHB, gamma-hydroxybutyrate, ketamine. So these are a lot of synthetic, MDMA is a ecstasy, is a synthetic psychoactive drug, has a lot of hallucinogenic properties, kind of resembles amphetamines in that regard. Meanwhile, you have GHB, ketamine, rohypnol. These are all predominantly depressants, and you can easily add them to beverages, and people can ingest them unknowingly. And these are how you get the date rape drugs. They incapacitate victims, right? They're depressants, and it prevents them from resisting assault of some kind, right? So again, these drugs are really, really dangerous. And again, I really wanted to give you guys just a breakdown of the different types of drugs, because the drugs are a really big issue, and pretty soon we're all going to be going into an environment where some of these things may be a really, really big problem. And I think it's really important that we're well educated about these issues, and thus we can make wiser choices regarding staying away from these drugs, and just knowing the kind of effects that they have. So good luck studying, guys. Thanks for watching. So I'll be doing chapter 13 now. Thanks.